What's going on, guys? Happy Wednesday. We are coming at you with another hip impingement video. This is our third video in our series of 4. So if you haven't seen our first 2, go back. Our first video was on the 2 types of hip impingement and how to figure out if it's kind of truly impingement through a little bit of testing that we kind of implemented. Week 2 was how your hip anatomy and hip joint position and socket depth can affect how you're squatting. Okay, so if you have not seen those, go back and watch those. Those are the foundation before we get to this third video, before we get to the fourth video. And this third and fourth video will be focused solely on treatment. Okay, so with that being said, my name is Dr. Choffner. I'm a strength and conditioning coach as well. I do physical therapy with people online and help them kind of get out of that hip pain and joint restrictions, help improve their mobility, as well as improve their strength in the kind of long-term process. All right, so let's dive into the topic for tonight. It's going to be hip impingement treatment. Okay, how to fix your hips and regain your mobility. All right, a lot of people are like, I don't want to work on mobility. It's boring. I don't really need it. Yes, you do need mobility, especially if you have hip impingement. If you have hip impingement, you most likely haven't been able to do certain exercises or certain movements with your hip because of pain or pinching. Okay, if it's truly impingement, you most likely will have some pinching or clicking going on. All right, so stop immediately what you're doing, grab a pen and paper. You're gonna write down some notes. If you want to use your phone for notes, that's fine too. Just make sure you stop searching Google, stop going on YouTube, doing these random exercises. I just got off a call with someone, potential client, who was doing these things randomly on YouTube, making the hip worse, kind of like he was just guessing and playing games and never testing and retesting. And that's such an important part of what you're doing, guys. Just like you track your expenses and you track how much money you make through your employer, you have to do the same thing with your body. You have to kind of test and get a baseline and then retest in another kind of 3 or 4 weeks to see if you're truly improving those symptoms and see if you're improving your mobility and your strength. Those things are so important. All right, let me not go too far out of the way there on that one. So what are we going to talk about in detail? We're going to talk about 3 things. Number 1 is foam rolling or soft tissue mobilization of the TFL and adductor muscles or the groin muscles. Number 2 is joint mobility. And number 3 is stretching. Okay, and that's in that specific order. That order is super important. Why is that order important? These things need to be done in that exact order if you want to see good relief, okay? And this isn't based on me. This is based on studies. This is based on how patients respond and my experience of what I've seen being a physical therapist for the last 5 years or so. Okay, so let's dive into the topic on why it needs to be done in that order, starting with number 1, foam rolling to the TFL and adductors, which are your groin muscles and your hip flexors. Okay, foam rolling, guys, should only be done for 1 to 2 minutes. This is based on research. You don't want to do it longer than that. It's not going to give you more bang for your buck. It's going to help decrease tension in those stiff, kind of taut muscles. And it's going to help release myofascial trigger points that limit your flexibility, and it might even cause pain. Okay, so definitely spend some time foam rolling. The TFLs kind of right on the top outer side of the hip. So if you have right hip impingement, you want to find that bone that pops out of your hip, it's called your ASIS, kind of travel down a little bit, a couple inches, and then over to the side a little bit. And that'll be your TFL muscle. It's really tight in a lot of people. It's tender a lot of times. So it's going to hurt when you foam roll it. That's completely normal, completely fine. It will help release these tight points after you spend some time in that position, laying on your stomach. And we're gonna have some kind of little images that pop up throughout this video you guys can check on and make sure you're in the right area too. The next thing is adductors, right? You wanna kind of foam roll those groin muscles anywhere from the upper hip down to the knee area, because the groin gets really stiff and tight because that hip doesn't like to internally and externally rotate, mainly internally rotate, so your groin gets really stiff. So again, spending 60 seconds to 120 seconds on both of those muscle groups is really going to help open things up and decrease those soft tissue restrictions. That's number 1. Number 2 is joint mobility. There's something called banded joint mobilization. So say you don't have access to a physical therapist, or you're just really busy, you want to start doing things from home, or you want to take 5 minutes before your workout to kind of do a little bit of mobility work, buy super bands. There's a brand called Leaky, L-E-E-K-E-Y. They're $30 for a set of 4 to 5 bands. It's the ones I have all my clients get. I get no kickback from this. You can get them on Amazon, really cheap. These are super bands or pull-up assist bands. You can literally put these bands up as high in the hip as possible and have it pull out to the side laterally. Don't have it pull inwards, that'll make your impingement worse. Have it pull out to the side and back a little bit, and that's actually going to stretch your joint. So it's actually going to make those taut ligaments that connect that capsule or that ball of ligaments to the kind of bone there to bone. It's going to kind of take away some of that pinching and improve your flexibility of that capsular kind of area, right? So if you picture this is your femur, right here, this is your femoral head, this is your socket of your hip joint. If your femur is like this, it'll help create a little more space by distracting it, because those ligaments connect from the femoral head to kind of here to the acetabulum or the socket. It'll help create and open it up a little bit. So you can actually have that band pull out as you do exercises and do a little bit of mobilizations where you push your knee in for internal rotation, you push your knee out for external rotation. And those are really great to hold for just 5 or 10 seconds, maybe doing 10 to 20 repetitions, okay? Which we'll dive into in a second. The third thing is stretching, right? We want to improve your muscle flexibility. So we already foam rolled your TFL and your adductors. We want to stretch those muscles afterwards, right? So we first tackle those soft tissue restrictions. We second kind of go to the joint. We open up the joint. And then number 3 is we want to stretch. We want to stretch those muscles that we just did soft tissue to. So how do you stretch your hip flexors? You go into hip extension, do the opposite motion. So you can do the half kneeling position where one foot's up in front of you, you're squeezing your glute and you're leaning forward. That's a great way to stretch your hip flexor. You can stretch your TFL muscle. You can lay kind of flat on your stomach, put a strap around your foot, pull your foot kind of up to your butt, and then pick your leg up a little bit. There's so many different ways. You guys can Google or YouTube this. Stretches are fine to Google in YouTube. Just be careful and make sure you're getting the form down properly and it doesn't cause increased discomfort. If it does, you have to modify it or do a certainly kind of different type of exercise, okay? Keep in mind too, guys, that strength is super, super important. And we are not addressing strength tonight. We are just solely focusing on mobility. So that doesn't mean you shouldn't do strength. Just know that to finish your treatment, the other half of the puzzle to kind of solve your hip impingement is strength. And we're gonna cover strength next week. So make sure you tune in. That's a super, super important. It might be the most important out of these 4 videos. It's gonna be our next one coming up, okay? So how do we foam roll, right? Again, very simple. You can always YouTube videos of this. You're gonna spend 1 to 2 minutes on those tight areas of your TFL and your adductors. You can pause on tender areas. Then you can put your leg through a little bit of motion to kind of help release some of those myofascial trigger points. Again, 1 to 2 minutes per spot. Joint mobility, again, using super bands, make sure they're very thick. Put them up as high in the hip as you can, get to the crease. Make sure they're pulling. If I'm working my right hip, I want it pulling out to the right. So attach it to a rig 4 to 5 inches off the ground. You can move the knee in and out. You can go in a quadruped position on your hands and knees, and you can work on getting the lower leg in and out. You can do rock backs into a squat. There's so many great exercises you can do to kind of open those things up, okay? And then the third thing is stretching, right? We want to do different types of stretches. Typically 3 sets of 30 seconds is the go-to for these. You can do a piriformis stretch laying on your back. They also call the figure 4 stretch. Those work really well. You can modify that and go to a seated position and cross your legs and do a forward kind of bend into a stretch. Or you can do a more intensive version and do a pigeon stretch on a box, where your leg's out in front of you on a box or a bench that's a good height, and you're leaning your trunk over it, over your leg out in front of you, and you're holding for 30 seconds. Those are great ways to open up that piriformis. You can even use a little lacrosse ball on your piriformis muscle, and you can cross your leg and spend time on that, and that'll help release that tissue, just like we did with foam rolling prior, okay? Another one of my favorite stretches is assisted hip airplanes, or they call them tippy kind of birds sometimes. That's a weird name for them. But you want to do 10 reps of a 5-second hold on these. And these are great. These are where you're holding onto a bar in front of you, or you're holding onto the back of a chair. One leg's behind you, almost like you're in a single leg deadlift position. And you're just trying to rotate that back leg inwards towards your belly button. Then you're trying to rotate it outwards towards the ceiling. And you're holding both of those positions for 5 seconds. This is a great way to improve your rotation of your hip without causing a lot of discomfort. So that is an awesome one to try. The other one I love to do is kettlebell weight shifts, right? So you can do 2 sets of 10 and hold for 5 seconds. You can get into a kneeling position on the ground, 1 foot in front of you like you were doing a hip flexor stretch. You can hold a kettlebell in front of you to keep your trunk upright. You want to squeeze your glutes, make sure your pelvis is tucked, and you want to lean into the stretch, getting your knee over your toes. So this is great because you're going to work your groin. So you're going to stretch those groin muscles that we already worked on doing foam rolling, but you're also going to work on your ankle flexibility at the same time. If you want to intensify it, you can tuck your back leg inwards a little bit. All right. If you guys have questions on these, or you want to see them in more detail, or you want to book a call with us, comment down below, comment hip impingement, and I'll be happy to get on a call or explain this more to you guys if we can find some time that works for the both of us. Okay. So that is foam rolling, joint mobility, and stretching. Okay. Again, we're hitting foam rolling 1 to 2 minutes per body part. We're doing joint mobility using banded joint mobilizations, so using a thick band going through exercise. And 3 is muscle flexibility through stretching, right? 3 sets for 30 seconds typically. All right, those are all of the exercises I want you to focus on for mobility. And again, in that exact order. I'm gonna say it one more time. I know I sound like a broken record, but it's so important. So foam rolling and soft tissue work first. You can use a little crossball if you want as well to get to more tender or more specific areas. Number 2 is joint mobility through using banded joint mobilizations. And number 3 is stretching, getting muscle flexibility. Okay, do it in that order and you'll see good benefits and changes. All right. So thank you guys so much for watching. This is our third video again in our hip series. If you haven't seen the first two, go back and watch That's Your Foundation. If you want to see treatment on how to strengthen your hip, then stay tuned for next week because that's what we're going to address in the next video coming up. So thank you. Please like and subscribe to our channel. We just hit 200 subscribers, so super excited and amped. Very, very happy to have kind of all of this kind of great kind of environment to be around and great followers and subscribers. And guys, next week we're going to give you a free full rehab plan on how to strengthen and bulletproof your hip joint and how to mobilize it. Okay, so stay tuned for that one. It's going to be probably the best video from all these four, and we're going to have a link in there that you guys can kind of click and get that full kind of rehab plan for hip impingement. All right, if you have questions, link them down below, and I will see you guys in the next one. Take care.